Struggling to make your private practice more profitable? The Profit First Academy by Green Oak Accounting is designed just for therapists, helping you boost profits, pay yourself confidently, and take control of your finances.
Join today for just $54 a month at profitfirstfortherapists.com/academy.
Feeling overwhelmed as a leader or helping professional in these chaotic times? You're not alone. Finding clarity and mentorship can be the key to avoiding burnout and stepping into your role as a leader. Our very own Katie Vernoy is offering dedicated strategy sessions to help you navigate these challenges.
Visit evolvetotthriveconsulting.com/modern therapist to learn more.
You're listening to the Modern Therapist Survival Guide, where therapists live, breathe, and practice as human beings. To support you as a whole person and a therapist, here are your hosts, Curt Widhelm and Katie Vernoy.
Welcome back, Modern Therapists. This is the Modern Therapist Survival Guide. I'm Curt Widhelm with Katie Vernoy, and this is the podcast for therapists about the things that go on in our field, the things that affect our practices. And one of the ongoing discussions that has really taken a really prominent role in our field, especially since the beginning of the pandemic, it was going for a while before that, but with all of the wonderful opportunities to utilize telehealth, to be able to meet our clients literally where they're at, why can't we see clients literally where they're at? And a lot of this comes around to discussions around license portability, around interstate compacts, around having a national licensure that we've heard these discussions. And Katie and I have been a part of these conversations in some aspects or another, particularly here in California and some of the legislation that goes on with it. We've talked about it on the podcast before, but we are also very privileged to have Roger Smith from AAMFT. He's the Chief Advocacy Officer, and he's here to also help discuss a little bit around kind of where the direction of things seems to be going, AAMFT's role in all of this. So thank you very much for spending some time with us today.
You're welcome. Thank you. Glad to be here.
So the first question that we ask all of our guests is, who are you and what are you putting out into the world?
Yes, happy to be here. Again, I'm Chief Advocacy Officer of the AAMFT. Been with AAMFT, the American Association of Marriage and Family Therapy, for 19 years now, and oversee as Chief Advocacy Officer all federal and state advocacy initiatives for the association. AAMFT has several state chapters, and so help work with them on state-level advocacy initiatives, including the Access MFTs Portability Initiative and getting MFTs into Medicare.
So just to help our audience frame things, can we talk briefly about the history of licensure portability and some of the compact stuff that has happened with some of the other licenses?
History of licensure portability and compacts has been one around for many years. When I started in AAMFT involved in advocacy 10, 15 years ago, it was an issue then. Traditionally, portability under state law has been under what is known as a substantially equivalent model. The idea is that if you're licensed, you can become licensed in another state if you came from a state that has substantially equivalent requirements to the state you want to come into. Sometimes it's phrased a little differently. Sometimes the question is not the laws as of the time you enter, but the law at the time you actually got licensed initially. So there are variations in that. It sounds good on paper. Well, apples to apples, we're going to have the same comparison. But in reality, it's very difficult to do so. Educational requirements don't exactly match up in terms of the coursework descriptions, even though if they are the same thing, the syllabi are different. Sometimes the supervised experience hours are different. Someone graduated from a 36 credit hour program, and now it's 48 credit hours. They graduated from 48 credit hour program. It's now a 60 credit hour program. Or they didn't have one particular course, and yet they are not able to become licensed. And yet there's been no findings in those areas that there's a harm to the practice of the profession and having someone not exactly line up exactly with those particular portability requirements. And that has been sort of the traditional model. And what has happened over time is there's been a lot of changes in that particular area.
With portability being what it is. And to be clear, portability is you're licensed in one state and then you go about and get licensed in another state. And what I'm hearing you say is that there's so much difference state to state on what licensure looks like, whether it's as an MFT or a counselor or a social worker or whatever, that it's been hard for folks to get licensed state to state. And we've had other organizations like the counselors, the social workers, the psychologists get interstate compacts. So there's a counseling compact, the social workers compact, the PsyPact. And I actually, early in this conversation, saw a webinar where you and some of the folks in our California Association of Marriage and Family Therapists were talking about the decision-making process of, do we make it easier to get licensed state to state, or do we go for an interstate compact? Can you talk a little bit about what the history was there and what AAMFT and other MFT organizations decided to do?
Yeah, a compact is a type of portability model. It's one type of portability model, and there are several others. Interstate compacts have been around for many years. They go back 200 years or more and have found in many wide variety of areas. In healthcare, compacts have been around for about 10, 12 years or so. The most common compact is the nursing compact. It's been around in 39 states now, 39, 40 states. There are now compacts for, recently, as you mentioned, mental health counseling that got off the ground about 2018, 2020. Psychology, PsyPact, it's been around for over 10 years, and social work compact, it's newer. And they do have a process where you have to develop a compact, the profession has to develop one, and then have a review process and submit it to various states. And there's also an organization called the Council on State Governments that oversees the compact process. And these laws have to be identical in every state. AMFT, along with other entities within the MFT field, looked at licensure compacts as a possible option, but ultimately decided not to do so, and really for a couple of main reasons. One is the cost. There's actually a significant cost to compacts, both in developing a compact, in other words, just getting people together and the costs of developing and coming together with that, but also the costs in getting compact licensure passed in various states. But then the real costs take ahead once the compact is in effect, because you have to have a compact commission that includes representatives from all the state licensure boards in the states that are part of the compact. They have to meet regularly. They have to have staff involved. And they also have to have a data set so that you can do more instantaneous comparisons. And if someone applies, they can get licensed quickly through the privilege to practice in these other states. And that computer program costs well over $1 million from what I've heard. They may go down over time if people work together, which there's been some efforts to reduce those costs. But then you have costs of maintaining the systems. You have the cost in running the compact boards. And those costs themselves, AMFT had looked at all the other compacts. We found that the existing compacts all appear to be losing money. In other words, the revenue obtained from compact certificate holders, licensees who have decided to join the compact and pay money to practice in various states, does not exceed the costs to maintain the compact. And so typically in that case, the ones who are left holding the bag, either state licensure boards or professional associations are representing the professions. And since state licensure boards, for a variety of reasons, will not be holding the bag in that, and the governing authorities and legislatures in those states won't allow that, it's up to the professional associations usually to backstop, if you will, or support that. And even in professions like nursing, that are large numbers of people who've availed themselves and joined the compact or part of the compact process, the costs still exceed the revenue coming in. The MFT profession is quite large at 81,000 LMFTs or so. However, it is the smallest of the non-medical mental health professions. And even the ones that are larger, like nursing, I said, occupational therapy, and others that have gone forward, have a lot more members and are able to generate more money. And so there's not enough money to support the compact, or it would be a huge drain on the entire profession. Also, not all people join compacts. So you could have a compact that Let's say in the MFT field, you might have 10,000 people or 15,000 or 20,000 who by 81,000 are supporting the 20,000, for instance. Secondly, the other factor is the MFT field is not uniformly distributed across the country. A, and B, not all states have adopted compacts. In particular, the states of California and New York have not adopted any healthcare compacts to date. Not even the nursing compact that's been adopted by 39, 40 states, not the counseling compact. And from what we have heard from various sources, those states so far are unwilling to adopt compacts. There are other states that have adopted few compacts, like Oregon or Alaska, and there are some that have adopted on the other side a lot of compacts. But in the MFT profession, a little over half of all licensees are in California. And if California does not adopt the compact, California licensees residing in the state of California cannot join the compact. You can't, as a California resident, go and join a compact your state is not part of, unless you actually move out of California to another state and reside there as your permanent residence.
And I think a lot of people thought that that would be the way around. I'm licensed in Arizona. Arizona is potentially likely to join a compact, but you actually have to reside there. So that doesn't help me, even though I'm licensed in Arizona as well. It does not help me get into a compact.
Correct. You have to have a privilege of practice in a state under these compacts, and that would be your state of primary residence where you'll be working.
Private practice owners, do you feel like you're working hard but not seeing the profits you deserve? The Profit First Academy by Green Oak Accounting is here to change that. Designed exclusively for therapists, this program is built on the proven Profit First framework to help you take control of your finances and grow your business sustainably.
With step-by-step coaching, live Q&As with Profit First expert Julie Harris, and direct access to accountants who specialize in private practice, you'll get everything you need to build a profitable, thriving practice. And the best part? It's just $54 a month with no long-term commitment. Sign up today at profitfirstfortherapists.com/academy. What have you heard as the reasons for states like New York and California not adopting any of the compacts?
We haven't really gotten, I guess, what you would say is an official answer from those states. From what we've heard, there may be concerns in those states, A, with maybe a perception of different or lower standards from other states. Those states are California and New York are the first and third largest state. Actually, New York may be the fourth largest state now in the country. And they've traditionally also had, probably compared to other states, more regulation or requirements, more bureaucracy or administrativeness on that. And so that may be a hindrance as well. We've also heard that some, particularly with some of the other not mental health compacts, with some of the others, that there have been concerns by other groups, particularly unions or those vested maybe interests within those states that are afraid that some businesses may, someone may abuse a compact and have a bunch of people flood into a state. I think maybe could be overblown perception, perhaps, where we've heard informally of those ideas as well. I think that there may be other concerns too. Also, larger states, and we've seen this in many other cases, tend to operate more as on their own or solo, as an island, if you will. Well, we don't care what those states say. Whereas maybe if you're a smaller state, you might be more concerned with, well, 30 states are on board and our neighbors, we'd better do it too. But if you're a larger state, a Texas, a Florida, New York, California, you might be able to say, well, we don't need to do that. It doesn't matter what the other states are doing. So those all could be factors. But again, I don't think there's been any, as far as I know, any statement by a legislative committee or governor's office articulating the views.
We talked a bit when the Counseling Compact came out. We'll put a link to that episode in our show notes over at mtsgpodcast.com. But we talked a little bit about some of the concerns around compacts with there are different regulations. It isn't a licensure, so it's very easy to get your privilege to practice rescinded. There's not a whole process around it. And so we'll leave that conversation on that episode. But it's clear from what you've been talking about and what we've seen is MFTs are going for parity, and they're going for a portability of making it easier to get licensed in other states. Can you talk about the efforts to date and what the goal is?
The goal itself essentially is probably the best way to describe it as maybe a full endorsement model. Endorsement is sort of the idea that one state will recognize another state's licensee and have through more of a streamlined process of licensure. You do not have to comply with the initial requirements for licensure, but it's more abbreviated. So it's sort of an expedited licensure process that we would have here. And AMFT over the last couple of years looked at this situation closely, even before the pandemic, during the pandemic, and decided in late 2022 to pursue a full endorsement model, or basically AMFT developed a model law, and it states that if you are licensed in one state, you can be licensed in another state without having to have certain years of experience or meet substantially equivalent requirements that are nebulous, we talked about earlier. And so someone who has been licensed for 1 or 2 or 3 or 10 or 20 years is an LMFT in one state and licensed in another state. Of course, that person would need to have an unencumbered license. And a state could, under our model, say, well, we think you've had too many ethics investigations, et cetera, and screen you out that way. Also, you would be required to comply with the state-specific requirements. Fill out an application, take fingerprints if that's required. You would also, in states that have jurisprudence exams, which many do, including California and other states, you would be required to comply with that requirement and take the jurisprudence exam in the state. Also, our model does indicate that you do not need to take a particular clinical exam, or you could either pass the AMFT-RB national exam or the California clinical exam. The key is, do you have a full LMFT license in one state? It's unencumbered. If you do, then you can come in through this pathway without having to prove years of experience or substantial equivalent.
What has been the response so far to where you're coming from? I know I've been participant in some of the California discussions around temporary practicing decisions, and California seems to have this model of, okay, we understand if you have clients moving into the state, and 30 days seems about right for them to be able to find somebody local. California being maybe off on its own a little bit here, what's the response that you've seen as far as introducing this to some of the other states?
It's been very good. We introduced the Access MFTs plan late 22 and 2023 to our membership, and membership has been excited about this particular model and moving forward with portability. Licensure portability concerns has been one of the major issues that MFTs in our profession have been commenting about and wanting AMFT to tackle as well. In 2024, we came up with the first year of legislation. So we came up with the plan, the idea. 2023 was putting together fact sheets, identifying lobbyists and states to targets. In 2024, we targeted 10 states for our first Access MFTs initiative. And the results, we can happy to report that in 9 of those 10 states, we pursued legislation. And of those 9 states, we have an MFT licensure law. In a couple states, there were amendments that passed in 7 states. And they were Arizona, Georgia, Illinois, Iowa, Maryland, Tennessee, and Virginia. And all those states passed our Access MFTs model. There were a couple of the exceptions. Arizona added 1 year, so you have to be licensed 1 year in a state. So I guess the two of you, if you've been licensed more than a year, you're fine, but you had that 1 year speed bump. Illinois, it's 2.5 years. Illinois has a lot more difficult portability laws overall, not just the MFT profession. So it's now 2.5 years instead of 5, and it's been streamlined that way. The remaining states, you can get licensed. If you have an LMFT license, you can get licensed right now in those states. And we've heard from members, some of those states, the laws are now in effect. We've heard from folks who were able to get licensed in Virginia, which you can effective July 1st. If you're licensed in another state, you can get licensed there. Prior to then, it took 5 years and meeting certain requirements. So it's vastly improved. In the other 2 states, we did introduce bills. They didn't pass, but we're going to be working next year will be Kentucky and North Carolina. The 10th state I mentioned is California. California, we are not pursuing legislation. As the two of you may know, there was a portability change a few years ago that reduced it to 2 years of experience. So, probably to see how that law works out. Instead, AMFT is working closely with CAMFT on an initiative to advocate that the national exam be adopted as a national exam in California. And happy to report in May, the Board of Behavioral Sciences agreed to go forward with adopting the AMFTRB national exam as the exam for all licensees in California. Again, don't go out and take in California national exam today and think it's the exam. It'll take a few years, probably 2 or 3 more years before it's fully effective.
So it sounds like for California anyway, there's work on both sides, but trying to come in and do a portability law is not on the books yet for California.
Correct, but I think that the exam issue is actually, and probably for California MFTs who want to practice in other states, the number one barrier is the exam issue. There are several states that have that. For instance, the law in Georgia until this year required that anyone coming from any state had to, through portability, had to take the AMFTRB national exam, which is a significant barrier for a California MFT, particularly practicing for several years, who wants to move to Georgia. And Georgia is one of the states that there's a lot of people moving to now. Under the Access MFTs initiative, that goes away. What matters is you have a California unencumbered license as an LMFT in California. Now you'll be able to practice in Georgia without having to meet that requirement. So for portability in terms of California MFTs moving out of state, that exam has been a big one. And I think we'll have to see how the 2-year law goes in terms of people coming into California from other states.
Are you exhausted and overwhelmed by the constant change and chaos? You're not alone. When the world feels like it's crashing down, people look to therapists and leaders for support. But who's supporting you? The pressure can be isolating, and without the right guidance, burnout is just around the corner.
That's where Katie Vernoy comes in. With years of experience mentoring leaders and helping professionals, she's offering dedicated strategy sessions to help you find clarity, confidence, and a clear path forward. Whether you're struggling with burnout, career decisions, crisis management, or even navigating the ever-changing landscape of mental health care, Katie will help you create a plan that works for you.
Don't go through this alone. Visit evolvetotthriveconsulting.com/modern therapist to learn more.
In some of this legislation, I hear you saying this is just about unencumbered licensure. I know some states that have amongst their licensure requirements like COAMFT accreditation. Is that something that you're running into in any of these discussions or in kind of planning out which states that you're looking forward to going in the future?
Yeah, it's a good question. And we have, on the latter, we are not looking at that or considering that as a barrier, even as a factor in looking at states to target for next year. On the former issue, there had been we've had a couple of questions from members, and I think at least in one state where maybe our state leaders would say, what about COAMFT versus non-COAMFT? That has come up in 1 or 2 states, but that has not been a barrier to passing the law or moving forward with the Access MFTs initiative. Most states actually do allow non-COAMFT graduates from non-COAMFT accredited programs to become licensed in a state. Sometimes it's a little more difficult because state law will say, if you came from a COAMFT accredited program, you're good to go, you can meet, and now you go on to the experience requirements. And then if you came from a non-COAMFT accredited program, then you have to meet the laundry list of requirements and state regulations and the education requirements. But in portability, I think at this point, after probably, if this had been 10 or 20 years ago, that would have been a significant barrier. But I think right now that COAMFT versus non-COAMFT accreditation in terms of portability is not a barrier anymore.
Which so helps California therapists. And I think the decision to go to the national exam will further help future therapists. But the fact that we're being kind of pulled into the, kind of sample law with being able to say, hey, we got licensed over here. It doesn't matter we didn't take the same exam, but we got licensed over here. Because the story I've heard is that California, we have, I guess, about half or more than half of the MFTs. we're pretty long in the tooth over here. We've been around a long time. COAMFT accreditation for schools is newer. There's no real impetus for schools in California to become COAMFT accredited. And so the fact that we're just all different over here in California, I think does indeed get helped by this, Access MFTs law. How are you deciding which states to pursue at this point?
Yeah, the states to pursue, we typically have looked at initially when our phase one states. One of the considerations were the states that were most active in passing compacts. Because if a state was passing a lot of compacts, that was a signal that they were very pro portability or pro modability states. So a lot of our initial states, like Georgia and Tennessee, were two of the top states on licensure compacts. And so we looked at that as a factor. We also looked at the level of interest within a state among state leaders. Because one of the things that we do is talk to state leaders before even making a decision whether to go forward, which we're doing right now on phase two states for 2025. But in terms of what we've done in the past and what we're currently doing is we look at that. So we look at interest by state volunteers. We look very closely at the state law. How bad is it? We've had some states where they made changes. Kansas and Utah, for instance, come to mind, where in the last couple of years, they've moved to 1 year of practice instead of 4 or 5 years. And so are we going to go into maybe a Kansas this year when they only have that 1 year barrier versus maybe a state that has 5 years? Plus, you have to come from a 60 credit hour program and you have to take this exam and stand on your head, and you have all these other requirements. You would go for the latter, all things being equal. So that was a key consideration. But also, we try to, in some ways, have states a little bit grouped together. We had a heavy presence in the Southeast, which is a very active and more friendly to portability overall. We did have one state in the West, Arizona. We're hoping to have more states maybe in 2025, where we had no states in New England. New England's another area that has not been as friendly to portability. We hope to have, planning to have some states up there next year. But we concentrate a lot on the Southeast, Mid-Atlantic, Virginia, Maryland area, and have some commonality there among those states, and also states in the middle of the country. There are also some states we didn't pursue as much because they have pro-telehealth laws. There are laws in some states, Florida, Idaho, Delaware, for instance, that allow you to register and provide telehealth services as long as you don't practice in-person services in those states. So if they have those laws, that when someone means portability, half the time or more they mean telehealth only portability. And then part of the time they mean in person, and then other times they mean both. But for those who are telehealth only, that sort of checks the box for those states, if you will, largely. And so we've looked at those factors, and that's sort of the lens we're looking at going forward as well, those factors.
So you're going to tackle the most challenging ones first or next in the second phase, get the ones that are super messed up, super opposed to portability, and see if you can whip them into shape and get them into an Access MFT mindset.
We are. I think we're going to get progressively harder. So there are some states we will not tackle. We're planning another 9 or 10 states. The ones that the two states, Kentucky and North Carolina, plus several other states. We will be having some announcements very shortly. There will be some large states on the list, 1 or 2. There'll be states in different parts of the country other than the Southeast and Midwest. So we'll have more geographic variation as well. We are working our way. We passed the laws passed in the Access MFTs initiative in 7 of 9 states, which is very good. So that's a very high percentage for passing it. We'll be getting in the states where maybe we hope to have 7 of 9, 8 of 9, 9 of 9 next time, but can't guarantee every year we have that. And we'll get a little harder as we go on. But we plan to go through this, and the idea is to eventually have these enhanced portability Access MFTs model law pass in all states, or essentially all states.
I know that as an AAMFT member myself, there were different surveys that went out to membership as you were making these decisions. And I'm curious because one of the things about getting licensed in multiple states is that there's a lot of cost involved. And it sounds like there's also a cost involved in joining a compact state. So there's differential costs, I think, but there's still both have costs associated. Are members wanting to have licensure or portability to a ton of states? Or what did it look like when you said, "Hey, do you want portability?" What did people say? What were they looking for? And what generally do you think is needed for increasing access for mental health services?
Yeah, we did have actually a survey, like you said, in 2022. It's been a while, unfortunately, since I've read the results fully. But what we found is a strong interest in portability. We had a survey, an earlier survey to that showed that a majority of people favored portability, and particularly our Access MFTs model we adopted was favored, and it was favored by the younger members even more than the more experienced ones, who are probably the ones who are more interested in mobility. But our current survey from 2022 found that there was interest in a lot of states like Colorado and Florida, California practicing. It didn't ask questions like drilled down necessarily on, well, if it costs $100 a year, would you do it? Or $200 a year, or $300 a year? And those are key questions. And there may be individuals who view maybe compacts as cost free and the Access MFTs model, well, if you get licensed in this state, in this state, in this state. And there are costs to getting licensed in various states through the Access MFTs initiative and states that pass those laws. But there's also an issue, cost to compacts as well in terms of joining a compact. And several compacts, depending on the compact, do charge a cost per state that's set by the state licensure boards in those states. So it's not you pay one fee and join 20 states or 30. You might have to pay individual fees in each state.
So it's not free. Portability is not free. So why not a national license?
Yeah, we get that all the time. That's a favorite question. Traditionally, licensure has been a state issue. It's something that the federal government has not been involved with. The federal government does not license any healthcare entity. They're involved in the drug industry, obviously, regulating that, but that's not closely related to being a licensed individual practitioner. And also, they're unlikely to do so. There are some constitutional reasons, but more importantly, members of Congress are very knowledgeable and attuned to some of these boundaries and the state's roles. They came from the states in many cases, the state legislatures. They're very unlikely to overturn that. It doesn't matter which party it is. So it's not going to occur that way. And you throw all your cards in one, all of your apples in one basket, which for MFTs are familiar with Medicare, where it took passing a federal law, and it was the last major plan to recognize MFTs, and partly because of that barrier, it's just you're either in or out. So there are many disadvantages, but the main reason it's just not going to occur for the reason that I mentioned earlier.
Where can people find out more about AAMFT and all of the wonderful things that you do over there?
They can find out various areas, amft.org. AMFT's website has a lot of materials. We do have an Access MFT's website. You just Google Access MFTs or whatever browser you choose to use, and you'll find a wide variety of information on it. It gives information on our model law. We have a nice, colorful map that lists all the states we are doing Phase 1 Access MFTs initiative, soon to be updated with the states we'll be working in 2025. We also have other information on some other licensure laws and even some states we're not working in. We do have a updated news article that has news releases that we have information all the time. You can even donate. You can also join AMFT's family team, which is AMFT's Advocacy network. It's free to join. You do not have to be a member of AMFT to join this network. And you'll receive, again, additional communications about advocacy initiatives, including the Access MFTs initiative.
And that would include when you should reach out to your legislators and put in a good word in your own state about Access MFT or other initiatives for MFTs.
Correct. And during the Access MFTs initiative in these states we've worked in, we did send out grassroots alerts and several, not too many emails, hopefully, but email communications to all members in those states and grassroots alerts when needed to ask them to contact their members of the state legislature and advocate for this legislation.
And we will include links to all of that wonderful stuff in our show notes over at mtsgpodcast.com. And make sure you follow us on our social media, where we pass along sometimes those timely sorts of announcements as well. Join our Facebook group, the Modern Therapist Group. And until next time, I'm Curt Widhelm with Katie Vernoy and Roger Smith.
Want to make your private practice more profitable? Join the Profit First Academy for just $54 a month and start taking control of your finances today. Visit profitfirstfortherapists.com/academy to sign up.
Need guidance in these challenging times? Katie Vernoy is offering special strategy sessions to help you navigate your career. Don't go it alone. Get the support you need. Learn more at evolvetotthriveconsulting.com/modern therapist.
Thank you for listening to the Modern Therapist Survival Guide. Learn more about who we are and what we do at mtsgpodcast.com. You can also join us on Facebook and Twitter. And please don't forget to subscribe so you don't miss any of our episodes.